Today, we're gonna be focusing on the top 3 secrets that are preventing you from reversing your type 2 diabetes. Now, before we go over the top 3, I just wanna give you some education first, especially for some of you who have never watched one of my videos before, because I want you to truly understand where and what the causes of your diabetes are. Because most of you are in the mindset, specifically from the way you've been taught, that if you just lower your sugars, it's going to fix the problem. Now, lowering sugars is obviously an important thing, but it's not going to reverse your diabetes. It may make things look better on paper. You may get a high five from your doctor saying you're doing a good job. But unfortunately, if we're just managing sugars or lowering sugars, it's going to allow the progression of diabetes to take place. Hence where the word comes from, or the statement comes from, diabetes is a progressive disease. And if you don't know that yet, you should know that even if you look it up on Google, it'll show you that diabetes is a progressive disease process, because the focus is on the sugars and not what's truly the cause, which is the cellular damage. And you can see here in this diagram specifically what should happen when you have normal physiological function. You see, the purpose of why sugar is so important is it has to enter your cell, but it can't enter your cells unless you have proper amounts of insulin. So insulin has to come down to your cells, and it attaches to what is called an insulin receptor. And when that happens, like a key for a lock, it's going to unlock the door in the cells to allow your sugars to enter the cell. And that's where all the magic happens. Because when you have proper availability of sugars in your cells, you're gonna feel better, you're gonna function better, you're gonna be free of many types of diseases that are due to progression of sugars getting worse inside your body, meaning the sugars go high. But unfortunately, as a type 2 diabetic, what's happening is at the cellular function here, this whole process is being blocked. Now imagine if this was happening on hundreds of thousands of cells or millions of cells in your body. Over time, when this occurs, the sugar is going to not be able to go into your cells, and it's going to go back into your bloodstream, causing elevated sugars to go up and up and up and getting worse and worse. Then eventually one day you go see your doctor and they run a blood test on you and say your sugars are out of control, you have type 2 diabetes, you get diagnosed, and they give you the recommendation to eat better, exercise, lose weight, and take medications. That's essentially your options as a type 2 diabetic. And all of these are focused on trying to lower your blood sugars. That's the entire focus. So if your focus is only to lower the blood sugars, is that ever going to fix why your cell is damaged? No. What do we have to do? We have to find out what's causing that X. What is blocking the ability for your cells to have normal function to allow the sugars to get in? And this is where the 3 secrets come from. Because unless you know how to identify this, how are you ever going to reverse your diabetes? How are you ever going to become a non-diabetic? And by the way, you can become a non-diabetic. The information that you're being told by saying you're going to have diabetes for the rest of your life and there's no way around it, that is a flat out lie. We see individuals reversing diabetes every day in our practice. We have an 85 to 95% reversal rate. And the reason for that is because of these top 3 secrets. So what's secret number 1? We have to understand that focusing on lowering blood sugars is not the solution. This is not going to fix your problem. So again, I'm not saying you shouldn't be doing things to lower your sugars. I'm not saying you shouldn't be eating well. I'm not saying you shouldn't keep weight at a good level. You shouldn't be exercising. Of course you should be doing that. The focus of this is, if that's all you're focused on, you're never going to be able to reverse your diabetes. Will you have good blood sugars? Yeah, you'll have good blood sugars, and you may even be able to keep them a little bit lower. But is it going to fix this problem over time? No. So what happens? You get worse with time, and the need for more medication just continues. More meds, more meds, more meds over time, trying to keep those blood sugars down when those other options no longer work. All right. Number 2, we have to understand what problems you have, right? Is the problem a specific organ that's involved in blood sugar regulation? Problems with the nutrition potentially could be a part of that problem. Toxins, infection, inflammation, on and on and on. So there are multiple things that could be going on inside your body that are contributing to blocking the ability for your cells to have normal function. So we have to identify all those different problems. We have to know each and every one of these. On average, what we typically see is between 10 to 17 problems that most of our patients are going to be experiencing. So if you're only focusing on one 1, 2, or 3 problems, is that going to fix the issue? No, you have to focus on all of these problems. Identify and address all of them, which is why it requires a customized solution. Each individual. I've worked with multiple, thousands of individuals in my practice over the last 20 plus years of doing this type of work. We've had husbands and wives with completely different problems that are going on that need to be addressed completely differently. This is why this condition is so unique and it has to be individualized. Which brings us to the last thing that we have to identify. And how are we going to understand what's going on up here? How are we going to identify all this? We have to test. And I mean, we have to comprehensively test. The days of you just getting your blood sugar evaluated, your A1C evaluated, maybe your liver function or kidney function, etc., on a very basic level are gone. Now, are those tests important to understand? Yes, if you're just managing your blood sugars with pharmaceutical drugs and lifestyle changes. But if you truly want to understand what's going on, we have to test, and we do comprehensive testing. If you're not interested in running comprehensive testing, then how are you going to ever find a solution to what's going on right here? You will not. And you would just hope and pray and cross your fingers of what you're currently doing is going to work. But unfortunately, hoping and praying doesn't reverse diabetes. Of course, there's some benefits from those things, but it's not going to help you to reverse your diabetes. We have to focus on these 3 things. Number 1, trying to lower your blood sugars alone is not going to fix this problem. Remember, we mentioned it again. These things are what helps you to lower sugars, but these things will not fix this, because there's usually other problems that are going on there. The second one is we have to identify what problems you're dealing with. How many problems? Do you have 5 problems, 10 problems, 20 problems, etc.? That has to be specifically identified for you so that we can create that customized solution. And the third one is we have to comprehensively test to identify what your problems are. If we don't do the proper analysis, how are we going to get the proper identification? And then more importantly, how are we going to be able to create that customized solution? So going back to the purpose of this video again today, the top 3 secrets. So the question you need to be asking yourself is this: is your goal just to lower your sugars? Or is your goal to actually reverse your diabetes? And what do I mean by reverse? That means you're getting off medications. You're having normal blood sugars. Your body is managing it again on its own. Because remember, at one time in your life, your body was able to manage your own sugars on its own. You didn't need excessive nutrition options or excessive weight loss or exercise, etc., or even medications. Your body did on its own, which means you have the ability to do it again on your own once you identify the specific problems. So once you identify what your goals are, lower sugars or to fix the problem or reverse diabetes, then you can start to understand what needs to be done. So what is your choice? What are you looking for? If you're looking to lower your sugars, make sure you watch one of my previous videos that's going to show you what needs to be done to help you lower your sugars. But if your goal is to reverse your diabetes, you have to have the proper analysis. All 3 of these steps have to be in place. All right, you guys, hopefully this video was helpful and helping you making the right decisions for yourself. And hopefully you're at a place now where you're starting to learn more about what we do, and make sure you join us for our next video as we go deeper into this condition of type 2 diabetes. Talk to you soon.